Did you just cough up bloody mucus? Don't panic, but don't ignore it either. Pink or light red phlegm could mean a minor airway irritation, especially after dry coughing. Yellow or green mucus with blood? That might point to bronchitis or a serious infection. Thick or hard mucus with blood can come from sinus infections or chronic inflammation. Look out for symptoms like chest pain, shortness of breath, or fever. These need medical help, fast. Document the color and amount. This helps doctors figure out what's going on inside your lungs. If you're coughing up blood more than once or it keeps getting worse, it's time to see a doctor. Stay informed. Share this video to help someone who might need it.